And you began this discussion is, how do we get into this story? Well, that's the big story. Is that we, societies around the world, starting in the United States, organized around our thinking around a false narrative of science. And that has changed how we think about ourselves. That's changed how we think about our kids. It's changed how we raise our kids. And what has been the result at a public health level? Well, mental disorders have, bloomed. They've blossomed. They've soared. Disability. It's a catastrophe. And that catastrophe could be predicted if you looked at the science. That's the tragedy.
It's just, you know what, Robert, right? When you think about this, I mean, we can laugh at it, right, during this conversation, but this is serious stuff. Like, this is the amount of people that are diagnosed with mental health issues, depression, anxiety, and all the rest of it, prescribed drugs, and they're on them for 10, 15, even longer, 20 years, longer than that. And the destruction that's taken place, and you would think as well, right? You would think that if they're actually making medical advances, that the amount of people that are sick would come down over time. But we haven't seen that, have we?
No, exactly the opposite. You're exactly right. If you get an effective treatment for that, for a particular disease, what do you see? Well, the burden of that illness goes down and outcomes improve. So you look at an untreated case of like diabetes versus a treated case, or how about an infection that isn't treated with antibiotics, or not with one that is treated with antibiotics. They run very different courses, of course. That's what happens when polio is an example of what happens if you get an effective vaccine. Polio, I was born in 1952. There was a lot of polio around then. We got the vaccine and it basically disappears. That's an example of what happens when you make a medical advance. The course of that disorder becomes less chronic and less functional impairment and that sort of thing. We have the exact opposite since we adopted this disease model. We see writ large, we see the course of these disorders becoming chronic. We see more functional impairment. We see much a rise in disability due to the disorders. And in general, we see the burden of mental disorders has exploded in our societies. We're all talking about a crisis. As you say, that's exactly the opposite of what you'd expect if you had a medical advance. And going back to what you just said, this is a tragedy of extraordinary dimensions in many, many ways.
Yeah.
One way is the wreckage of human lives. There is so much wreckage out there of people who were doing okay, hit a blip, and then they went down a road, and then like 8 years later, they're now, they're on 8 drugs or something, with other lives diminished in many ways.
Yeah.
Whereas if it had been conceived of as like a temporary setback, which is what people used to have all the time, they might have had a time of difficulty, but it didn't mean their life was going down this other path. The other thing is, and now you're not as crazy in the UK as we are in the United States. Let me ask you, what percentage of our college freshmen in the United States arrive on a college campus when they're 18, 19, with a diagnosis and a prescription? Take a guess.
You want a percentage or do you want an actual number?
Percentage.
Oh, God, I'm going to say 20% of students on a campus, I'd say.
Okay, no, that seems incredible, right? Seems insane. It's about 25 to 30%. And more than 50% of college kids are now accessing mental health services at some point during their 4 years. What that tells you is we've created a narrative that encourages parents and kids to see themselves as suffering from a psychiatric disorder. And now you have kids who come to counseling saying, I have bipolar. They self-diagnose. And then they say they want the diagnosis and they want the prescription. So if we talk about the wreckage Can you think of doing anything worse to kids than to have an environment where they're encouraged to think of themselves as abnormal, as unable to be resilient? Can you think of doing anything worse to kids to prepare them to be mental patients for life?
Do you know what, Robert? Right, this is that there is shocking. And I became aware of this consciously. I mean, I've always been aware of it, I suppose, but I really started to look into this around March this year, and I had a little theory going on, and that was, well, I'll go back a little bit further. So what happened is that I was looking into testosterone levels in men. There's a drastic drop, which is a whole different topic. And then I started looking into mental health statistics here in the UK, and I came across something quite shocking, which was that 16 to 24-year-olds in the UK, over 60% are apparently have symptoms of depression. Now, I almost fell off my chair when I read that, and I was listening to the radio then a few days later, and I heard something which was like a helpline for loneliness in 18 to 24-year-olds. And it was like, he gave a shocking statistic just like the depression one. And I couldn't believe what I was hearing. And I'm thinking, we're supposed to be the most advanced society that's ever been around on the planet. And yet here we are in the midst of an epidemic. It seems, an epidemic of mental illness. Now more than ever, there's never been a time in history where we have so much mental illness, or so-called mental illness.
So here's this, what you've just said is so important. What did you say, 60% of kids in Britain, in the UK, from 16 to 24 have sort of symptoms of depression, right? Okay.
Yeah.
The disease model says the problem's inside the individual kid. Okay, that they have something wrong with their brain and they're mentally ill. And that's how they see it. What is that statistic really telling you? It's telling you that there's something in your society that is making kids unhappy. That's what that statistic is telling you. That somehow you've organized your society in a way that kids are unhappy in it. And what you should be looking for is, what are the causes of that unhappiness and that misery? It's just taught. And that's part of the tragedy here, too. Human beings are responsive to their environment. Aren't you responsive to your environment? I mean, if you have things going good in your life, you feel better. If things are going to crap, you feel worse. Also, if you're able to eat well, exercise, all that story, find meaning in life. If you have someone to love, all that stuff.
Yeah.
You're responsive to your environment. Kids are responsive to their environment. I also know that kids, when they're young, when they're babies, boy, they're lovely creatures. They're curious. They light up the world with their smiles if they're treated in a way that makes them feel so. You see this being sort of so eager to move through life. If 20 years later, so many of them are depressed, it's not because they got a disease in the brain. It's because there's something we're doing in terms of the society we've organized. We haven't created a system. We haven't organized ourselves well that makes kids feel valued, allows them to move into adulthood, allows them to be curious, that sort of thing. This is part of the tragedy, is that we take societal signs of societal stress as signs of illness within them, and that we try to treat the illness within them, when clearly, if you have this explosion of people anxious, stressful, depressed, you got to do something about your society.
100%. Yeah, it's because I'm a huge advocate for personal responsibility, and I try and push that in everything that I do. I'm responsible for me and the outcomes that I have in life, and and especially with how I think and how I feel. I have the conscious ability to program my thoughts and my feelings. And there doesn't seem to be that kind of, that narrative is not pushed. That, in fact, is the complete opposite.
So again, what this is really poking out the tragedy of this narrative, right? Because the tragedy of the narrative, if they say you have a disease, is that you can't do anything about it other than take the drug. So it is a pessimistic sort of message, and it robs you of any sense that you have agency in your life. You're talking about agency, right? I can build a life that I want to lead.
Yeah.
Now, there was a study a while back about some guys in Canada, particularly writing about it, not just in Canada, which looked at people who didn't accept that narrative, that became depressed in Canada, but didn't accept that narrative. And so they didn't take the drugs. And there's a similar study in the United States. Well, guess what happened? They made changes in their life because, in essence, they were taking the depression as a sign that there was something in their life that wasn't right. That meant sometimes quitting jobs and finding different jobs, different relationships. The point was the group that rejected that disease narrative made changes and actually retained their agency, the sense of, I got to make something different happen in my life because this one's not working for me. The group that bought the disease model, took the drugs, they didn't make so many changes. So, for example, that group was 7 times more, I think that was in the U.S. study. That group in a U.S. study of, I think it went for 6 years, was something like 7 times more likely to end up on disability than the group that didn't buy it. And the other thing was the group that bought that narrative tended to have a lowering in their social functioning in terms of employment, social engagement, that sort of thing. They found the group that didn't buy that narrative actually at the end of the 6 years was now employed at a higher level because they made changes in their life.
Wow.
So what you just said is, which of these two narratives actually presents you to go on a better course long term? The one that says you're diseased for life, you're abnormal, take a drug, and that's too bad. You really can't do anything about it. Maybe you can add on to it maybe if you want. Or the one that says, wow, you need to make some changes in life. And you want and the depressive symptoms may be a sign to you, an evolutionary sign that you should do something different. And people who struggle out of depression in that way, often find that, I do have an inner resilience. It can even be a sense of like, I overcame this difficulty. And I became a wiser person. I became a braver person. I became a stronger person. So this is part of this is part of the harm caused by this false narrative. It takes away our understanding that human beings can be resilient, they change, and also that life is like this. It's not easy. And life is like you have good times and bad times, right? It's a false philosophy of life. And that's part of the real problem and the tragedy, in my opinion.